Welcome to our webinar on how to efficiently manage and process your unapplied money, your line item credits, and your refunds in NextGen. My name is Tom Seco, and I am the Business Development Manager for DAS Health. Before we get started on today's webinar, I want to cover a couple items regarding the webinar. First of all, let you know that this webinar will be recorded. The second item is everyone's phone will remain muted throughout the entire webinar. So if you experience audio issues, please use the chat box to let us know so we can resolve them. And the third is I also want to let you know that there is not a one-size-fits-all solution for the ideas that we express in today's webinar. I would also like to introduce Joel Scholes. Joel is our Product Solutions Director. He and his team developed the solutions that we are talking about today. This is an agenda for what we're going to cover today. I'm going to take about 90 seconds to give you an introduction to DAS Health. But as we go through the webinar and talk about these two solutions, there's basically three common themes that we have developed with all of our add-on products over the years. They are: one, making the job easier; two, making the processes more efficient; and three, saving people time. So we're going to show you how you can make the processing of unapplied money, copays much easier. And if you do take deposit money, we'll also show you how you can manage that much easier. We'll also show you how you can make the processing of line item credits and refunds much more efficient. And at the end of the presentation, we'll answer all of your questions. So during the presentation in the webinar, you may type them in the questions area of the webinar control panel whenever they occur to you. And like I said, we'll answer those questions for you at the end. So who is DAS Health? We are a leading provider of health and IT management solutions, a trusted consultant to many physician groups, hospitals, and healthcare systems across North America. We have 20+ years of experience with NextGen. We have a broad and deep portfolio of services to offer our clients and prospects. We have over 100 employees in the company. We've worked with over 425 clients that use NextGen. Our passion is to work with our clients to improve patient care, work with our clients to enhance the patient experience, and work with our clients to maintain a financially healthy practice. Our mission is to improve the healthcare experience by delivering the highest value health, IT, and business solutions to our clients. And over the 20 years that we've been working with NextGen, we've developed a strong relationship with NextGen, and we'll continue to work on that relationship with them. Bottom line is we're here to help and serve you in any way that we can. This is a quick look at our solutions and services model. I'm not going to go into each area, but I will point out that we divide it into three areas: practice management, information technology, and patient care. The two solutions that we're talking about today, that streamline and automate the processing of line item credits and issuing refunds and processing unapplied money, falls into the productivity products and enhancement category of practice management. So that's a little bit about DAS Health and who we are. So let's get back into what we're here to talk about, and that's the processing of unapplied money, line item credits, and refunds. As I mentioned earlier, for audio clarity purposes, everyone's phone will remain muted throughout the entire webinar. And if you do experience audio issues, please use the chat box to let us know. And as questions come to you, please enter them into the questions box, and we'll answer those at the end as well. As you most likely know, there's two types of credits in NextGen. There's unapplied credits and line item credits. Line item credits typically occur because of overpayments and erroneous adjustments. And unapplied credits typically occur, when you receive money in advance of a service, like taking co-payments, or if you take deposits, taking those deposits prior to surgeries or diagnostic procedures. Even money that's received through third-party applications, such as kiosks and third-party apps on tablets, can come into NextGen categorized as unapplied money. This is a busy slide, but really what it shows is that the one product that we're talking about today, the Unapplied Deposit Manager, deals with the unapplied credits in NextGen. And then the Refund Manager software, the second product that we talk about today, deals with the line item credits. And the two combined together, if you were to implement both both systems in your practice or in your health center, you now have a comprehensive credit processing solution. This slide shows the process improvements of the Unapplied Deposit Manager software. The lighter colored boxes are the points in the process that you no longer have to do. The software does it for you. So it goes out and finds the unapplied balances based on the rules that you give it. It goes out and evaluates those items that it finds against the rules that you give it. It creates all those transactions for you, so you no longer have to manually do that. You maintain control of the view process, so when the batch is created, you can go in and review the batch and make any appropriate changes, and then you maintain control of the posting process. So let software do all the heavy lifting for you. Like I said, you maintain control of the review process, you maintain control of the posting process. This is the process improvements that you'll see in with the Refund Manager software. Again, all the lighter colored boxes are the points along the process that Refund Manager touches in some way, in either streamlining the process, eliminating data entry in the process, integration in the process. So as you see, it does touch many points along the process, from billing all the way through accounting and then bringing information back into NextGen as well. There's 3 modules that you're going to see in the Refund Manager demonstration. Because it's an interactive program, the 3 modules that you'll see is the Credit Scout module. That's the first module that allows you to find the credit balances on the patient accounts based on various filters and search mechanisms that we have created. It allows you to take action on that credit balance that's found. So you can either issue a refund, or you could distribute that credit to an encounter that has an open balance on it, or you can even task it out to the work log manager to be looked at later. The second module you'll see is the Batch Detective module, and that's the one that brings the refund information over to your accounting applications. So you can just feed that information into accounting applications, so you no longer have to do the data entry there. And then the third module is the import module, and that is the one that brings the printed check information as far as check number, check date, check amount, and brings that back into NextGen and updates the patient account, patient chart with that information. So you'll see these 3 modules in the demonstration as we go through it. So what I'm going to do is going to turn it over to Joe, and Joe's going to take you through the process of both products.
Great, thank you, Tom, and thank you for everyone for joining us today. We're going to switch over to my demo environment here, so you may see a bit of flicker on your screen, and then you, if things go well, should see NextGen Practice Management. I'm going to go ahead and take you through the Unapplied and Deposit Manager and then the Refund Manager. A couple things to note: the Unapplied and Deposit Manager is a rule builder. So it's the kind of tool where you document what you need it to do, and then it goes ahead and executes that night after night on your behalf, and you come in the next day and you have batches available. Refund Manager is a little different. It's more of an interactive tool that you deploy to a number of analysts working your line item credits so that they can take action on them. And the reason for that difference is because with Refund Manager, you're potentially sending money out of the practice. So we want you to have eyes on each transaction that may be going out. Now, the good news is you don't have to do much more than click a checkbox to make it happen, but we do want you to go ahead and approve it. So let's go ahead and start with the Unapplied and Deposit Manager. So this is that rule builder. So I'm going to come in here and show you some examples of rules that we've already built out in the system. These are not what the system is limited to, rather these are just some examples of common scenarios we run into helping practices with their Unapplieds. So I'll take you through these real quick. Now, we're going to cover a lot here in the next 15 minutes. Don't worry if you don't catch it all. We'll be happy to do a one-on-one demo of either or both of these tools with your practice one-on-one. Just reach out to us. We'll have our information up at the end again, and we can go ahead and schedule that. The user interface for the Unapplied and Deposit Manager is really straightforward. At the top, we have our rule sets. These are what we're trying to accomplish. And again, these are just some examples I built out. We could have one big rule set that does everything, or we could have a bunch of small ones that do individual things. The advantage of breaking them up is that we can turn on and off rule sets as we need them. So if we're doing a cleanup and we're done with the cleanup, we can disable that one and not have that one run overnight, speeding things up. Now, when we click on each rule set at the top, we get the instructions for that rule set at the bottom. And think of these instructions as if you were sitting down with a new employee and explaining to them what you need them to do to clean up unapplieds. And that's really what you're building out in here. So if we look at this one for copay cleanup, and we go down to this first instruction, encounter unapplied equals specific amounts, go ahead and apply it up to that amount. So this is what we chose to build out for this scenario. So you'd sit down if you were having someone clean up copays and say, hey, start with $5, $10, $20, go find all those encounter unapplieds and get them moved down to the line items. Let's get those caught up. So we're doing that here, and in the case like this one where we need parameters specified, there will be a label here in the pop-up column, and it'll give us the appropriate form to input the parameters. In this case, it's dollar amounts, but it could be date ranges, it could be name ranges, it could be locations, providers, all kinds of things that you can use to further refine what it is you need the system to do. If all we were doing was copay cleanup, we just need this one rule set named here and this one line here, and it would go ahead and do that. These other lines coordinate so it doesn't step on what the other rule sets are going to do. A little more complicated one is the basic cleanup. And that's the case where practices come in and they let us know, hey, we have either months or years of unapplieds we got languishing out there that we need to get those cleaned up. Everyone's screaming. So can you help us with that? So this one is a little better example of a more complex rule set that you can build in here. So the instructions, again, they just get built out and read left to right. Encounter unapplied equals patient amount, apply it up to the patient amount. Encounter unapplied if it's greater than the patient amount. Obviously, if it's greater than, you can either apply it up to the patient amount or over apply it and come up with a line item credit that you could then refund. In the case of this scenario that we built out here, we're going to apply it up to the patient amount. We're going to leave that remaining money in encounter unapplied because down here on the fourth line, we're going to take that money, move it up to the account, and from account unapplied, we can use it on other encounters that may have balances. Again, keep in mind, this is a cleanup one, so we're trying to get old stuff out of there. We can refine this work with what we call scopes. And these scopes, again, are where you limit it to specific dollar amounts, transaction codes, practices, date ranges, all kinds of great things. So in this case, we're saying, you know what, skip encounters with no charges because those might be encounters that were just created and the charges haven't been entered yet. So we don't want to go pulling the money up to the account just yet. And because we're in cleanup mode, let's make sure the insurances have been cleaned up and they're all zeroed out before we apply the money, because then we'll have the most accurate representation of what the patient owes. So we can have many more encounter unapplied and encounter scope lines. These are just the ones we chose to build out for this example. Now, if we're handling the encounter side of the equation, we also want to handle the account side of the equation. So we're going to have money that either gets moved up to the account from the encounter or gets applied directly into account unapplied. So in this case, we're going to take the remaining amount and go find the oldest balances and walk it forward. Another one we added in here is sometimes money's just going to sit out there in account unapplied. There's nowhere to use it. The patient hasn't come in a long time. So we have this instruction down here, account unapplied remaining amount. Let's age it, then push it down to a new encounter as a line item credit, and then we can refund it using RefundManager. So I can set the parameters for how long I want to age it, and the service item that we're going to use to indicate that it was a refund. We just set this up in our service item master and give it a zero cost. So whatever money we put against it will all become line item credit. And similar down here, we have let's make sure the insurances are also zero. Now, when I build one of these out, I'd set how often I want it to run. I can set up the descriptions for the batches, and then I can hit save, and the job in the BBP will execute it nightly. If I'm testing, then we'd normally go ahead and scope it down to like specific providers, locations, to get a real small set where we can quickly get it to run and see the results. Because I'm working in my test database here, in my demo database, I can go ahead and kick this off and it'll run right away. And down here I can see, here's a transaction that it aged out the money and pushed it down onto the encounter. So these are just the transactions that have been pushed into our NextGen batches. We'd see the same thing if we went over in the NextGen into the batches. Sometimes we get clients coming to us that are using a third-party system to take payments, and those payments come in ahead of the charges, so they land in encounter unapplied. And if the charges are flowing over from somewhere else, you don't always see that prompt that says, hey, do you want to apply the unapplied to this charge? So this will kind of be a backstop for that. So again, we have the same encounter unapplied equals greater than less than, but in this case, we'd limit it to the transaction code or codes for the money coming over from the third-party system. So just another way that it can be used. And then the last and truly unique thing we can set up is deposit management. How often do we take money in that's for future use, and somehow we got to track that in NextGen? We're setting up dummy encounters, we're maybe putting it on unapplied, we're leaving notes out there, we're using dummy sims, and we're hoping that people catch that later when the procedure happens that the deposit is for, and they pull the money, and meanwhile, they don't pull the money for some other visit in between that the deposit was not intended for. So we give you the ability to set up what we call tag sets for deposit management. And that's really a cross-reference of the deposit code used to intake the money. So when we put it into encounter or account unapplied, we'd use a specific transaction code. And we'd set that up in your file maintenance. And for that transaction code, we'd give it a tag or name. So when it sees money come in on that account, it'll say, oh, this is deposit money. I'm going to set that aside. And then it'll continue to watch that money each night for new encounters on that account that either have the selected service items or modalities, right? The groupings of service items that it's looking for to use this. So if we had 10 individual service items, we'd have 10 lines with fertility deposit. We just call these whatever we want, just so long as they match from the left to the right. Or if they're all in the same modality, we can just go ahead and pick a modality. And the cool thing is you don't have to do that tracking anymore. The system will take care of this for you and manage that deposit unapplied money. So again, all examples of how the Unapplied and Deposit Manager can be used. Setting up a new rule, we give you templates to get started, so we can do a new rule set. We can go ahead and save up here, and then down here we can either build out rules individually, or we can start from a template. If we were doing that basic cleanup that we were talking about, it'll give us the lines to go ahead and get started. If we wanted to say, you know what, let's make sure the insurances are 0, it'll go ahead and add those lines. If we're testing and we only want to work with accounts in specific names, so we're only working with a subset of them, we're not having to, trudge through the whole database, we can go ahead and pick last names and range and work with all our people whose names start with S through T. So we can kind of pare it down while we're testing to get smaller data ranges that we're working from. Now, we can also do things like prioritize certain service items over other service items, only apply to certain service items, all kinds of stuff that we've built in here that we've run into working with clients such as yourselves out there. So the Unapplied and Deposit Manager, the takeaway is it's a rule builder. You document what you needed to do, much like you'd tell one of your staff, and each night it'll go out there and create batches for you to review and post the next morning. Let's go ahead and shift gears now and talk about line item credits. And RefundManager is where you handle the line item credits. And with RefundManager, you're either gonna move around patient line item credits or refund patient or payer line item credits. So we start out here in the Credit Scout, and this is a tool where you can qualify what types of credits you're looking for and what date ranges you want to look across for those credits. And we can also slice and dice by a number of other criteria here. But in the essence of time, I'm going to go ahead and pull up a search here of credits that I was looking for, I'm going to start with distributions, which is the ability to move that patient line item money. So I've got a list of guarantors here and their credit amounts. I can go ahead and expand this down. I'm going to pick on Shirley here, and I can see Shirley has a $95 credit on encounter 1212. And because it showed up as part of my distribution, I can click the D checkbox, and if I want, I can first preview what it's going to do. On the left-hand side is where the money's coming from, encounter 1212, $50 credit. And it's, in this case, it's staying on the same encounter, just moving to another charge that didn't get paid off. So maybe that second charge wasn't there right away. Additionally, we give you the ability to create that pairing of where the money's coming from and going to. So instead of doing a distribution preview, I can do a distribution match. And on the left side here are the credits that the money's going to come from. And on the right side here is where it's going to go to. So if you wanted more control or wanted to change the order not to be oldest to newest, you could go ahead and build those pairs here. So now to create these transactions, to move the money around, this is patient line item credit money. So instead of us having to go in and create these transactions that we see here, we just simply say, yes, we'd like to create these, and it's done for us. Now, we always recommend to do distributions as your first pass through the credits, and then for your second pass to look for the refunds. And as part of training, we'll go over this filtering in more detail. We can even do it more during the one-on-one demo. But I can come in here and find my candidates that I want to refund. So I can come down here to Jennifer, who has a $122 credit, and underneath I can see there's 3 encounters that make up the credit, and I can still go down to the charge level. But in this case, since there's several encounters, I may want to look at the account summary and see how the money looks across all of the encounters. In this case, I can see it's fairly clean, that we're going to need to do a refund. So I can go ahead and check in the R column for refunds. All right, and we can go ahead and pick on Jennifer here. Now this will also do refunds for insurance companies. So if I come up here to Tiffany, who has a refund credit in the payer bucket that will refund out, I can see she has both credits on Aetna and United Health One. So she may have had different insurances on different encounters. So again, we can expand this down if we want to see the detail. We can go ahead and see the financial summary and account summary and make our decision that we're going to refund it. If we don't want to do anything, we just don't check the box. If it's a messy one that we just want to task out for someone to go clean up in NextGen, we can go ahead and put it in the work log by clicking the T checkbox. So I'm going to go ahead and click a few more of these just so we have several to export out, and I can show you how fast it is. So what we're doing here is we're streamlining the process. We're giving you a way to look at the credits, do a quick evaluation on the credits, and then you just click the checkbox for if it's a refund or a move, and right here it just created 10 refunds for us in a mouse click. This is where most people will spend their time using RefundManager here in the Credit Scout. Now, what I've done is I've created some distributions out there and I've created some refunds out there. So we want to go ahead and get this batch posted because it's going to take care of the distributions. And then we need to get the refunds out to the accounting system so we can send the money back to the guarantors or the insurances. So I'm going to go ahead and balance this and post this. Now we integrate with about 20 different financial institutions and financial systems. If it's not one that we cover today, we're always adding more every year to the system that we integrate with. So down here we see our distributions, moving the money around, netted out 0 because it's a plus and minus of the same money. Up here we see our patient refunds, and here's our insurance refunds, and we can see Jennifer's 3 refunds here. So now this next part is even quicker than what we saw before in the Credit Scout. So I'm using an older database, so I'm gonna find my batch that has my refunds in here. And instead of me sending a report to accounting and having accounting key that information in, I simply do an export and click a button, and it'll either generate the file or talk to the accounting system in real time. So depending on the capabilities of the accounting system. In the demonstration environment here, we're using QuickBooks, so I can go in here and see that my checks have been added. Here's Jennifer with her 3, totals 122. I haven't printed them yet, so we don't have check numbers. Accounting loves this because they're out of that data entry business. They just go ahead and review it, set up the check stock, print them, confirm that they all printed okay, and now they have their checks ready to go out. But to close the loop, let's go ahead and go back to RefundManager, and we'll import that check information back in from the accounting system. Again, whether it's a file from the accounting system or it talks program to program with the accounting system. So now if I come here into NextGen and I pull up an encounter from Jennifer, we'll keep using Jennifer as the example here, we can see there's documentation from when it was created, when it was exported. So it's creating these encounter notes to let you know what's going on. And on the refund transaction itself, since we've completed the loop, it's got that check number, check date, check amount in there automatically for you without you having to do the data entry back into NextGen to get that money in there. So that's the quick overview of RefundManager, an interactive tool. You give it out to your credit analysts who are going to work the refunds and the line item credits. It streamlines and automates that process. We're close to the end of time here. I'm going to turn it back to Tom. We'll finish up and answer any questions.
Okay, thank you, Joe. So as Joe mentioned, we realize each of your practices or health centers operate a little differently with the processes you have in place. So if you do have some questions, you'd like to have a more in-depth discussion about one of the products or both products that we learned about today, give us a call. You see our contact information up here on the screen, and we can go through that with you. So as Joe mentioned, we can start to talk about any questions that you have. You want to enter them into the questions box on the webinar control panel. We can answer any questions that you have. So here's a question. If we issued $1,000 worth of refunds, when does that money get committed?
In the RefundManager process, we recommend that you post the batch before it goes out to the accounting system. So that way the money doesn't get changed to NextGen that's going to the accounting system. We want them to be one-on-one. Now, sometimes practices don't do that because you have to manually go in and add the check information. But because it's just a comment field where that check information is going, you can post the batch and we can go ahead and still add that check information in the database later on.
There's another question. Will the vendor file in my accounting application continue to grow each time that I issue a refund to a patient or to an insurance?
It depends on the functionality of your accounting application. We've taken some steps with each accounting application to minimize that impact. For some accounting applications, we can go ahead and set up a master vendor with different contact addresses underneath it. In other ones, there's the concept of a temporary vendor and kind of a one-time check. So we'll take advantage of that where possible. And for some of them, we'll just have to create the vendors because that's a limitation of the accounting system. So again, one of these things we can discuss with you in a one-on-one demo and figure out which scenario you're in. If chances are you're already using the scenario in your manual process that you're in today anyway, so you're used to it.
Here's a question. Can we see only the accounts that have over $500 in credits?
In RefundManager, when you get that list of credits on that initial search, you can click on any of those column headers to sort it. So you can go ahead and sort it by amount and then, put the higher ones first or the lower ones first and skip over the ones that are lower than you'd want to do.
This one's related to the Unapplied Deposit Manager. Can you explain again what a tagged account is?
Yes, the tagging is just a way of earmarking deposit money, because you could have deposits coming in for several different purposes, and you could consider that all deposit money, or you could make it more individualized. Each deposit can only be used for a different specific thing. So the tagging is really just a name for that. And then when we see the money come in using a deposit transaction code, we'll tag it, set it aside, and then we'll keep watching for the particular service item or modality of service items that we can use it for in the future.
Okay, so it's the top of the hour, so we'll go ahead and close out the webinar, but you see our contact information up here on the screen. Go ahead and send us an email or give us a call, and if you have more questions, we'll get those answers for you. Again, if you'd like to have a more, I know that Joe went through the demonstration of the products very quickly. I think the high level concepts are there, but if you'd like to have a more in-depth discussion about either product or both products and how it would fit within your organization, again, send us an email, give us a call, and we can schedule time to go through that with you. And thank you very much for joining us today. Have yourself a great rest of the day.
Thank you, everyone.